everybody, it's Molly, one of the occupational therapy students here at ASF. In this presentation, I want to talk about the Pseudobulbar Affect, otherwise called PBA. So what is the Pseudobulbar Affect? By definition, it's a neurological condition that results in outbursts of uncontrolled or inappropriate crying or laughing. And this affects the way the brain can control your emotions. And this occurs with many other neurological conditions. Examples are stroke, Alzheimer's disease, Parkinson's disease, ALS, multiple sclerosis, and many others. So the symptoms are that exaggerated crying or laughing at inappropriate times. So for example, you may be in a situation where you would typically feel slightly sad, but you find yourself crying uncontrollably. Or a situation where it's kind of funny, you might giggle, but you find yourself in tears because you're laughing so hard. Outside of these, you experience all your emotions as you typically would. With PBA, crying is more common, which is why it's often mistaken for depression. But there are differences we need to note between the two. The PBA episodes are going to be short, while depression causes a persistent feeling of sadness. So your PBA episodes may last a few minutes or a little longer, while depression would probably last for weeks, months. Depression also results in sleep disturbances, loss of appetite, while PBA does not. So for a diagnosis, you would see your physician. So you could see a neurologist, a psychiatrist, or a neuropsychologist. And some questions they may ask you, or you can ask yourself right now, is the emotional response occurring involuntary, suddenly, and without my control? Is the emotional response inconsistent with my mood or inner feelings? And does the emotional response cause me significant distress or limit my ability to work or interact socially? Along with the questions, there are some standard questionnaires that your physician may give you. One of them is the Pathological Laughter and Crying Scale, or the PLACS. This is a doctor-led interview. So your doctor will ask you a series of questions that relate to the frequency, the severity, and the appropriateness of your episodes. Typically, this scale is given to survivors of stroke. Another one is the Center for Neurologic Study and Lability Scale, or the CNS-LS. This is a self-administered scale, and it has a series of 7 questions. And again, they'll ask about the frequency, severity, and appropriateness of your episodes. This is typically given with ALS or multiple sclerosis diagnoses. For treatment, unfortunately, there is no cure, but there are some oral medications that doctors can prescribe to help manage. And the overall goal is to reduce the frequency and severity of the episodes. So some typical oral medications are antidepressants, so the tricyclics, SSRIs, and SNRIs. The doses given to manage PBA are typically much lower than the doses given to help manage depression. There are some other drugs. One is called Nurdexa, but ultimately it is between you and your physician to decide the best treatment plan for you. Along with medication, there are some coping strategies that you can try. One is to just educate others about your condition. So by educating others, it makes others more aware that when you have an episode, they're not taken back. They're not confused at what's happening. They understand that this is not you, this is the stroke, and this is a lasting effect of the stroke. Also for you, if you're experiencing an episode in front of somebody that you've already educated on your condition, you feel more comfortable because you know they understand this isn't you. This is still a lasting effect of the stroke. Another strategy you can use is when you feel an episode coming on, take a minute and take some slow, deep breaths. Those deep breaths that we talk about during exercises and stretching and mindfulness. So you take a deep breath in through your nose and out through your mouth. Continue to take these deep breaths until the episode has subsided or you feel in control again. Along with deep breaths, try relaxing your muscles. I know for me, I feel tense in my shoulders, in my jaw, in my forehead. So take note, relax those shoulder muscles, relax your jaw, your forehead muscles, any other muscles that you may feel are tense. Try relaxing those. And along with relaxing, to help, you may need to change your position. If you're standing, try taking a seat. If you're sitting upright, leaning on a table or a desk, try leaning back in your chair and really employ those deep breaths and relax those muscles. Changing positions doesn't always mean how you're standing or you're sitting. You may also need to just remove yourself from the room. Sometimes, not always, but sometimes there could be a trigger that caused the episode. So if you can safely get up and leave the room, just step out for a moment until you feel in control again and come back, feel free to do so. If you don't feel like you need to leave or you don't feel safe getting up and leaving the room, try focusing on something else. For example, look at a shelf. Count the objects on that shelf. Count the tiles on the floor. Whatever you can do to help distract your brain could potentially minimize the severity of the episode. Next time you feel an episode coming on, I encourage you to try employing some of these strategies. Some of them may work for you, some of them may not, and that's okay. Every person is different, much like every stroke affects people differently. But again, I just encourage you to try employing some of these the next time you feel you have an episode. So in summary, PBA is very common to experience post-stroke. A lot of people don't, but many do. And you're not alone in experiencing this. I encourage you to talk to your doctor. If you're experiencing any of these symptoms, please consult your general practitioner, your neurologist, your psychiatrist, a neuropsychologist. But also, before you talk to them, start taking notes of the frequency of your episodes. Do they happen multiple times a day or multiple times a week? How intense or severe was the episode? Did it last for a long time? And in what situations were you in when you had an episode? Also take note of how you feel after the episode. Do you feel relief? Sadness? Does that sadness persist? The more information that you can give your doctor, the better of an idea that they will have of what's going on and a better treatment plan that you two can come up with together. Again, there are some medications that you can take. Those are the antidepressants or some other ones. But also try some of those coping strategies we just talked about. You'll try those slow, deep breaths, relax your muscles, change positions, focus on something else. And that last coping strategy, educate others. Educate others that this can last for a very long time after your stroke. So these are some of the references I used: the American Stroke Association, the Cleveland Clinic, and the Mayo Clinic. There are so many other resources out there. I highly encourage you to do your own research. The more information you have to take to your physician, the better of a treatment plan that your physician and you can create. Thank you all so much for taking the time to listen to my presentation, and I hope you have a great day.